If your newborn sounds like a tiny bulldog at 2 in the morning, grunting, snorting, even pausing and then breathing fast, you are not alone. Most of those noises are normal. In the next few minutes, I'll show you what's okay and what means it's time to call your pediatrician. Hi, I'm Cherry, a certified maternal and newborn nurse, and I keep the jargon out and the real help in. Let's talk about normal newborn sleep sounds, clear red flags, and simple things that you can do tonight. Newborns are natural nose breathers with tiny nasal passages. Even a little dryness or mucus can sound loud. Soft whistles, snorts, squeaks, especially during feeds and leap. You'll also hear occasional grunts as they work through gas or a bowel movement. That's common in the first weeks while the gut gets the hang of things. And then there's the breathing pattern. Many babies have brief pauses, about 5 to 10 seconds, followed by a few faster breaths, then a steady rhythm again. That's called periodic breathing, and it can look dramatic. But if their color is normal and they settle right back into easy breathing, it's typically okay. And if you want calm, step-by-step help for those early weeks, I built a free private resource hub just for moms like you. Inside, you'll find guides, checklists, and even my 0 to 10 newborn plan. The link is in the description below. You can join for free and get instant access. Noisy can be normal. Working hard to breathe is not. Call your pediatrician urgently or seek care if you see breathing over 60 breaths per minute at rest. 2. Nostrils flaring, chest pulling in between the ribs or at the base of the throat, or what we call retractions, or a grunt with every breath. 3. Blue or gray color around the lips or tongue, poor feeding, unusual sleepiness, or a long pause in breathing around 20 seconds or more. Important tip, this symptom is a 911 call. This is an emergency and your baby needs immediate help.